Joining us now is Ian Tate, Communications and Social Media Director for the Ambulance Paramedics of British Columbia. Ian, thanks for taking time out of what I know is a very busy day, very busy start of the year to join us today to have a chat about what's going on with Ambulance Paramedics of BC.
Yeah, thanks for having me.
So I reached out because I saw this social media post from the Ambulance Paramedics account. Breaking news, BC Paramedics Union requests veteran mediator Vince Reddy to help with contract negotiations and avoid a potential life-threatening strike. Of course, there's a picture of Vince, and the word strike really popped out. So what's going on, Ian? What's happening?
Yeah, so we've been in contract negotiations since early September of last year. We've got a lot of work done, a lot of the non-monetary stuff agreed to in principle. There's a couple remaining things in the contract, obviously wages, compensation, but we have the government mandated general wage increase, which is kind of locked in stone. But there's a second pot of money where you make improvements to the collective agreement called flex money. So the last offer and what the government said was our final offer or their final offer was substantially less for our union that other public sector unions have agreed to and settled for in the last couple of months. So that didn't really go over well. It's definitely not something our members are going to accept. And it's definitely something that we can't accept right now.
It sounds like bargaining has broken down. If I look at the press release you guys put out on December 30th last year, a paramedics union declares breakdown in contract negotiations. It's right there in the subject line. What has broken down in the discussions? Has somebody walked away from the table, or do you just feel that there's an impasse because the government's not moving more in your direction around kind of that secondary tier requests around the flex pay?
Yeah, like we haven't really had any dates at all in in December and this year. So we've had one date on Friday of last week, where we basically said, like, listen, we're requesting Vince Reddy to be appointed as a mediator. We also have kind of an alternative dispute resolution thing that we floated to just say, like, we need to get back to the table here. Like, we don't want to strike. The paramedics will strike, but we don't want to strike. We know the ramifications and what that looks like in the real world, especially in the face of, what's going on in healthcare right now. So at the end of the day, we're going to be able to say that we bent over backwards and did everything that we could for healthcare and for our patients. And then, currently it's the ball's in the government's court.
What really stuck out with that press release was a quote from APBC President Jason Jackson, where he says, "Our members have stepped up time and time again without hesitation, yet we continue to see ambulances sitting unstaffed and hundreds of vacant positions across the province. Without meaningful improvements to wages, benefits, and wellness initiatives, we will continue to lose skilled professionals and communities will pay the price." When I read that ambulances are sitting unstaffed, I thought, wait a minute, we have hospital ERs that are closing. We have maternity wards that have shuttered, pediatric units that have been closed and opened back up. And now we've also got ambulances sitting unstaffed. How is that possible in 2026 in BC that ambulances are just sitting without paramedics?
Yeah. So, a little bit of it, we're kind of the victims of our own success. So, I have to give credit where credit's due. Like, we've completely, collaboratively rebuilt the ambulance service in the last 10 years with the government, with BCEHS. So we have added thousands of full-time positions. The problem is our wages, compensation, and, BC's affordability is not really allowing us to recruit in the numbers that we need. We are barely keeping up with people that are retiring or even going to different organizations for work. As far as first responders go, you look at police, fire, nurses, we're the lowest paid significantly out of all of them. So when you look across Canada or even internationally to try to recruit people to come to, arguably one of the least affordable provinces in Canada, it doesn't really match the wages and the affordability to attract people here. That's why we look at wages and compensation. And, part of it is obviously for our members, like, there's no lying about that. But a lot of it is like, if we want to fix staffing, if we want to recruit, we have to have better wage and compensation package, or people are not going to come here to work. And we're seeing that now with, I believe we still have over 400 full-time positions empty.
Over 400 full-time positions sitting empty in the ambulance paramedic service in BC.
Yeah, at least that. And we know they're trying. Like it's not, they are in rural, remote, and sometimes indigenous communities. So unfortunately, those areas are, disproportionately affected by staffing like this. And this is why when we talk about a strike, those areas are going to be hit the hardest when it comes to a strike. And then on top of that, when you look at these, never ending ER closures, if we end up having ER closures in communities where ambulance staffing is disproportionately affected or disrupted altogether, that's kind of a nightmare situation for us.
So how are you filling positions right now with ambulances sitting empty and like 400 at kind of a minimum? How are you filling positions?
Well, those positions aren't being filled, but what's happening is our members are going across the province working overtime and on their holidays and on their days off to try to staff these positions to keep communities safe. So we have a traveling paramedic program where, paramedics are being flown all over the province from one end to the other on their days off and on their holidays to try to keep ambulances staffed. One of the issues that we keep bringing up is in all of healthcare, usually when you work overtime, it's double time. Ours is only time and a half. And, like it is a privilege to be able to work overtime and, make extra money for your family. But at the end of the day, we have one of the highest burnout rates in all first responders. So you can only squeeze so much out of a workforce before the, post traumatic stress injuries, the burnout, the compassion fatigue. We're seeing all of those numbers climb in the ambulance service, and it's a sign.
I was just gonna say, I mean, you're pulling people out of holidays or you're pulling people off of days off to go around the province, doing something that they obviously love to do. I mean, paramedics, I know several here in Victoria who really love what they do. They are the front lines. They love the fact that they're there helping to get people from, a crisis situation to someone who can help. Like they are that important bridge, that lifeline to crisis situations throughout the community. But you have to wonder, you talk about burnout, you talk about compassion fatigue, you talk about all the impacts of having to pull people away from holidays, vacations, days off. I can't help but think that burnout results in workplace safety issues as well when you have people just working beyond what they're humanly capable of doing. What does that look like for your members?
Well, like I said, we're noticing some very alarming trends in the ambulance service. So 2025, we declared a mental health crisis. We've had, a 5 times higher rate of members dying by suicide last year than we've ever had. For an inquiry into that and what's going on, it's not sustainable to keep up the high levels of overtime that our members are working. Like I can't give you numbers about what kind of budget line items are for overtime, but it would be absolutely, shocking, I think, to the public to see how much overtime is necessary just to keep the ambulance service afloat. And then, that ties in with what we talk about with a strike. Now, we are an essential service. So there's no walking off the job. We don't walk off to go staff a picket line. It's all controlled by the essential service order. But even if members decide to work less overtime and to not come in on their holidays, that alone will have substantial implications to staffing. And we're very concerned about what that could look.
Well, and that kind of creates, you talk about that compassion fatigue, but there's also probably an internalized guilt of saying, if I don't show up, someone might die. I mean, that's kind of the reality of the situation when you have paramedics doing the work that they do. And you mention the workplace safety issues and being an essential service, but that doesn't mean that people aren't able to access long-term disability or long duration injury claims or things like that. So what does that look like when you look at disability or injury claims, especially for long duration?
Yeah, well, this is one of our asks about where that flex money goes, right? Like the flex money for us, from my understanding of what our negotiations and our president and our lead negotiator says, is the flex money is what gets improvements for our members outside of a general wage increase. So when we talk about flex money, we talk about improving mental health supports for all of our members and their families. Having more access to psychologists so that when people are injured, they can talk to somebody right away, not months later. They can get the help they need and then they can come back to work quicker. So like those types of things pay for themselves in wage loss. We talk about changing overtime from 1.5 to 2. That alone would help improve staffing overnight. And we've seen that because there's been small periods in the summer where they approved double time overtime. And it was obvious on the street that there was less ambulances empty. It was very clear. I don't know if BC EHS agrees with that, but I would go to work and be like, wow, there's a lot more people at work today than normally when there's those summer staffing initiatives. And then we also look at, protecting contracting out language and job protection in areas. But there's multiple communities throughout BC where they have a 24-hour ambulance and it's staffed by 3 local people. And if you think about that, there's I've heard stories from our members where they're like, I worked 21 days in a row. And I finally had to take 2 days off to take my mom into a medical appointment in a different community. And the ambulance was shut down for 2 days. And people would show up at my house knocking on the door, wondering why an ambulance is coming from 2 hours away. And he's like, listen, I needed a day off. We don't think that that's sustainable. Now, that's not something that can be fixed overnight. Lots of these different communities, they have their own issues attracting people to their said communities. And we understand that, like the doctors and the hospitals are having the same discussions. We speak to municipal leaders all the time that say, how do we attract working families here? How do we attract doctors to our small town? And, that's a whole other conversation about what municipalities can do. But we've always said for years, first you have to offer proper full-time paying positions, and then you can at least start the search.
Well, and also ensure that you have for lack of a better word, the bodies to do just the kind of the foundational work that you need to do, which is impossible when you have 500 or 400 vacancies at a minimum and ambulances sitting empty. I recall there was a story last year about, I think it was up in Stewart, and the region had no ambulance service. And I was like, this is crazy, because these are communities in the north where you have mining projects and different infrastructure projects and different kinds of resource development stuff going on, and to not have an ambulance available, it just blew my mind. I can't imagine the stress and the strain and the worry that people in these communities must face.
Yeah, and I think Stewart was the community I was actually referring to in that example there. We've seen that time and time again where, these small, rural, remote communities, a lot of them, are responsible for providing service to Indigenous communities as well. They are disproportionately affected. And we understand that not every rural, remote, and super rare community is going to have the same response times as if you live in downtown Vancouver. Like, people choose to go live in a lot of these areas, or they grew up there. We understand you can't have 6 ambulances in some of these small communities. Like, we get it, but we have plans. We come to the bargaining table with ideas and solutions to try to fix this. And this is one of the unique things about our union is we are there to, fight for our members. But as a secondary plan, we are also there to fight for healthcare for all British Columbians when it comes to the ambulance service. We know the role we play. We know the gaps in healthcare that we fill. When we talk about rural, remote areas, Indigenous communities working in the downtown east side and these communities, the ambulance service and the paramedics are the healthcare system for a huge demographic of people that don't have family doctors, that don't have a walk-in clinic or an emergency room in some of these communities. During the ER closures, we see that what happens when there's a close sign on the emergency door. They always say, call 911, that's us.
You mentioned the downtown east side, and I can't help but think about the impacts of policies on kind of frontline workers. I think about decriminalization and safe supply and the overdose and opioid crisis that we've seen. I wonder if you can give the audience a bit of insight into how kind of the framework around those policies, specifically thinking about the decriminalization policies, how does that impact your members?
Yeah, so decriminalization is an interesting one. So when I first started in the ambulance service, the police were always involved in overdoses. And what I saw is when we decriminalized drugs, we almost made it acceptable as a health emergency instead of a crime emergency. So I am a supporter of it, and I think the ambulance service is as well. Now, was it done perfectly? I think a lot of people get harm reduction tied up and misinterpreted with decriminalization. We understand that these people are addicted, they're sick, and they need help, and they need healthcare help and treatment and dry out centers and detox, all this type of stuff. That's not easily done overnight, and the costs can be substantial. I know the ambulance service, specifically my union, we're big supporters of things like nasal naloxone and trying to improve the game out there any way we can. Those types of things matter and save lives, but it's really hard when you look at the numbers in British Columbia because they don't look great. And it's been a long 10 years. And to be honest with you, multiple years before that, before it got declared a crisis, we've seen a lot of death. We've seen how that affects families. We've seen how it affects communities. And, type of narcotic crisis and toxic drug crisis, you know, not all of it happens in alleyways. A lot of it happens in people's homes, in their teenagers' bedrooms, and in undesirable areas of their community, but also, like in mansions, it happens. So it is a tough thing. It has to be a health issue, not a police issue. So decriminalizing, to me, like, what do you do with someone that's suffering from an overdose or they're sick with some type of drug addiction? Do those people deserve to be in jail, or should they be in the hospital? The issue is we're not really winning the battle. So it's easy to say it's not working. But when I look at, opioid addiction and the crisis as a whole, it's very hard to measure wins because all we have as a bar for it is the deaths. That's all we get is, this many people died this year. What people don't realize is we are reviving like 100 to 1 overdoses that die. So it's actually 100 times worse than people realize, but there's so many paramedics and fire department and, bystanders that are giving Narcan. If Narcan didn't exist, all of those people would have died. It would be tens of thousands of dollars of lives a year that died from that. So it's actually really sad, but I feel for a lot of these people and organizations because there's so little data about the wins. It's all measured in the losses. And I can imagine that if I was in frontline addiction support, just like some of our members are, it's very hard to feel like you're making a difference. And that's really troubling.
Yeah, there's obviously the public perception gets challenged too, because you get to mix in with that and what you have when you kind of walk down main streets of a lot of the cities that we're in, and you don't see it getting better. You don't get the sense that it's getting better. And I'm sure with you guys, you see a lot, you're treating a lot of the same people over and over again. And that must feel, I don't want to put words in your mouth, but it must feel a little self-defeating at times to say, my gosh, I just really wish this person would get clean and would get better.
Yeah, like I've only worked in the downtown east side a little bit. I was a supervisor at the station down there for a short period of time. When I think about going down there when I was a younger man, it's 10 times worse down there than it's ever been. It's very hard to see that level of suffering. And you look at the unhoused, you add mental illness, you add addictions. It's like the perfect storm down there. The thing that we don't realize is this is all tied to poverty and mental health and people with trauma. It's just so hard after all these years to see that these are actually just really suffering people because they live in like an unrecognizable state to what the average person does. When you see these tent cities and you see them living on the street, it's heartbreaking to realize, and it's dehumanizing where, some of my pets don't live like anywhere near what these human beings are living like. And it's heartbreaking because we can't fix that. The ambulance service is there for a very targeted period of time. And a lot of times, quite frankly, when we revive them, they get up and they take off. There's no thank you. There's no like, let's see what we can do. Very few of them are getting connected to resources through the ambulance. They want to get out of there and then we go to another call. So like our frontline, interpretation of it is a very specific thing. And I think there is a gap there in getting people resources and services that they need. But then there's also the reality of it is, and I think people have a hard time, a lot of these people don't want help. They don't want housing. They don't want a treatment center. They are in their addiction for whatever trauma that they are trying to sedate with. And that, I think, is where, a lot of the beginning help needs to start.
Yeah, no, for sure. I want to just circle back because I think in this whole conversation, we're really talking about the front line of healthcare that unfortunately, we're obviously glad that paramedics are there, but people who engage in it, they're in a crisis and they're doing it because they need to, and you guys there and you step up. Given the context, given the breakdown in contract negotiations, given calling for Vince ready to come in and concerns about a strike, a lot of people look at that and they think, the strike that we just had last fall was the longest public sector strike in the province's history, and that created all kinds of challenges. How do you see moving forward? Because when I looked at the CTV story about this last night, I don't recall if it was the minister, if it was EHS, but someone said, well, we're inviting the union back to the table. And my thought was, it sounds like whoever it is, whether it was EHS or the minister, is putting the blame on paramedics, on you guys for not engaging. And I thought that doesn't sound like what I'm hearing. What I'm hearing is you guys are saying, look, we agree with kind of the first part of this discussion. We have another part here that's not meeting the moment, and we're stepping up in ways that we've never had to before. You guys need to meet us halfway. Am I getting that right?
Well, I think the reason why there's a breakdown is when the government says, here's our final offer. They're putting, their stamp on it, saying this is it, we're done bargaining. Our negotiation team and our leadership and our executive is ready to bargain tomorrow at 9 a.m. They are 100% prepared and ready to go. They want nothing more to negotiate a fair and equitable agreement. But when you have one party that says, well, this is all we're willing to give, that basically concludes bargaining. Like they're basically saying, we're done, we're not speaking anymore. This is it, take it or leave it. So, that's how I consider it. I saw the article as well. I think I was quoted in there. So that's from HEABC, so the Health Employees Association.
Right.
They're the agent for the government that bargains with us. BC EHS is also there in a capacity as well for expertise. But we the condition that bargaining's in right now, with them saying that this is their final offer, we need a mediator to come in and trying to break the stalemate. Because our position is when they say to us, hey, this is all we're willing to do, not one thing more, that's a stalemate. And we need somebody, a veteran mediator, to come in. We've worked with Vince before. The ambulance service definitely has, and the government clearly has. We believe that there's, a lot of cost savings that we've brought to the table. Like I said before, we come to the table with solutions. We're not just there saying, hey, how much? We come to the table with fully researched and cost packages and say, hey, we've looked at scheduling, holidays, deployment. There's a way here to save $5 million if we change it to this way. Okay, let's try that. We might disagree on the costing or the savings, but we are behind a vast majority of these proposals when we come to the table, because it's to our interests, for our members and the public, to improve the ambulance service. From the other side, my understanding from it is that they come up with all sorts of ways to cut costs. Well, a lot of those have to do with services or compensation and benefits for our members. We come to the table where we say, let's cut administration and issues and deployment things that aren't working, then let's try this where we could, save $5 or $10 million a year, and then we'll pass that savings on to other improvements. So, I hear from my president and our lead negotiator that says, we're bargaining with ourselves at this point, right? We're there by ourselves. So we will come back to the table at any time, but we're not going to come back to the table if it's the same offer that they handed to us at the end of November that they said was the final offer. We're not going to come there to bargain with ourselves. We want to come there and bargain appropriately.
And so it seems that a strike vote is imminent. It sounds like the beginning of next month. Is that, if I'm understanding timelines right?
Yeah, we've spent the last couple weeks doing online and in-person info sessions for all of our members. Like we have a lot of young members that don't even know what a strike is. They've only been in service for a few years. We're just educating them, like, listen, this is what we need to do. This is what a strike vote means. It doesn't actually necessarily mean we're going on strike, but we're fully committed and we're ramping up big time. This week we're doing picket captain training. We've put out an expression of interest for it. We're going full steam ahead, but also trying to hope diplomacy comes through.
How can we improve working conditions for ambulance paramedics? To me, that is what I think the foundational question of all of this is. And let's contextualize this. COVID was an insane time for everybody, and no doubt for ambulance paramedics, it was insane as well. You compile that with the overdose opioid crisis, which was happening at the same time, and you've now got hospital shutdowns and all the challenges in rural and remote communities. So the question really is, it is about improving working conditions for paramedics. How do we do that?
Yeah, so, a lot of the ways that we can do that, I think actually pay for themselves. When we talk about mental health supports, like that's a big one, right? 30% of our members are either off work getting treatment or still at work while getting therapy or treatment. So 30% of our members are currently in some type of system where they're getting support for PTSD or CIS or whatever you want to call it. But they need to see a psychologist quicker. Like we're hearing reports from our members that go off work for something horrible that happened that aren't able to talk to a professional for months. Like that's not okay. They just sit at home spiraling when we think that they should be seeing somebody in a few days, if not a few weeks at the longest. That allows people to get into treatment, to get some skills and training and support systems, and then come back to work sooner. So that would effectively pay for itself. Any type of education or mental health funding we consider to be an investment and not some type of compensation to members. That's a big thing. As I'm sure you can imagine, burnout is starting to become a lagging factor of what COVID was. Like I'll never forget when, I was on vacation when COVID started and people were texting me when I was on the beach saying, "Hey, there's no more beef at the store and people are stealing toilet paper." And I remember when I got home, they started calling me when I was going through immigration. And I worked almost every day for 2 years during COVID. And you're seeing now people with the heat dome on top of that, the opioid crisis on top of that. We always joke that, the 24 months of COVID was the longest 10 years of our career because it was life changing for a lot of us and everybody in healthcare, first responders, let alone just regular working people. When you think about what transpired and happened over that amount of time, we've never seen anything like that. And I don't know if we ever will. So that was a long time to be in healthcare. Like we were the ones that were putting on the Tyvek fully encapsulated suits with the respirators going into people's homes. Like when you talk about who's on the front line, like the paramedics are on the front line, the front lawn, the front street. Like we are there taking those people out of their homes, and taking them to the hospital. So it was a long couple years. We're still seeing people suffering from effects of that. We say now that, like a couple years ago, we had psychologists tell us, you're going to see lagging factors down the road of these mental health claims and CIS go through the roof. And just like they reported to us years ago, we're now seeing that. Mental health and wellness supports is a huge thing. Our compensation and benefits, it's a very interesting labor market out there because young workers that want to come in to be paramedics, from what I see, they don't want to work every day for an employer till the day they die. They want work-life balance. And if we're not going to offer that, if we're not going to offer flexible scheduling and holidays and proper compensation, they are going to go elsewhere. And we're seeing that. We are not attracting anywhere near the amount of paramedics that we need to attract to sustain our model. We're just not. And in fairness, I don't think any area of healthcare is doing it. The doctors aren't sustaining it. The nurses aren't. We're no different. For us, it's not massive pay increases. We just need to keep up with other first responders so that when we have a virtual job fair and there's the police, the fire, nurses, we can't be 30% less in wages. It's fine to have a little bit of flexibility there, but our last contract closed the gap on that a little bit, but we're starting to pull back a little bit more. And a general wage increase with other exceptions to premiums over time and extra funding, that helps a lot. And when we think about having 6,000 members, that's actually not a huge price tag for the government when you look at that, because mental health and wellness supports are only accessed when members use those money. So it's not like if you say, hey, every paramedic is not going to have $1,000 a year, they're now going to have 2,000. Well, that's actually not times 6,000 members. That's only the percentage of members that will use that money. So it's actually not that much money when you look at it over what it does for savings and what the actual cost is.
Just before we kind of conclude here, I just kind of thought about attrition, because I can imagine, we talk about COVID, we talk about all the impacts of the heat dome and everything else that's led to today. You talk about new folks coming in, but I also wonder about attrition. Do you have a beat on like what your 5-year attrition rate is?
So what I'm seeing is that we're barely keeping up with our retirees. We're at the age now where all the baby boomers are retiring or in their final 2 years. There's very few people with gray in their sideburns in the ambulance service anymore. So like I'm in my late 40s and I'm considered like an old man in the ambulance service. When I was around, it's like we had lots of guys in their 50s and early 60s. Those guys are all gone. So I believe it's 30 to 40% of our membership has less than 5 years seniority. So that means they're mid 20s. And the way the ambulance service works now and the way mental health works, we don't believe that those people will be 30-year employees. We think that they'll come in, they'll work for a few years, and then they'll transition to something else, which is common just in this labor market now. Like you don't see people when they're 20 start with an organization and retire at 60. Like people just don't do that. They move in and out of different work and stuff like that. So that's fine. But we are
It's not the workforce of our grandparents, is it?
no, it really isn't. It really isn't. You stick with a career or a job and you keep doing it until you're done. That's just
Yeah.
not the way it goes. So we are very worried about retaining staff. And, like not very many weeks go by where I don't have coworkers asking me if I can be a reference on an application for their police department or their fire department application or border guard or some other type of thing. Like that happens very regularly. I had one yesterday.
And I
So
imagine you grit your teeth when you get those calls.
well, like I also am like completely understanding of that.
Yeah, of
Right? Like
course.
I get it. I get it. And I'm, in defense, like I love our brothers and sisters in the fire department and the police, but I don't want to be an officer, a police officer in
Yeah.
this day and age either, right? So, but people are leaving. They're looking for different work. They want to make a more of a difference if they can, and they're also looking at, when Surrey Police Service, first started, like a 3-year constable makes $30,000 more than a 10-year paramedic.
Oh my gosh.
So that's a
Wow.
lot. That's a lot over
Yeah.
a career, right? That's that could be millions of dollars over 25 years. So, I understand that. It is what it is, and I wish all those people the best. But this is another thing that we've been bringing up, that if we can't offer flexibility, wages and compensation, mental health supports, job protection, if we can't offer that, we are going to struggle way worse in the next 5 years for retention.
Well, Ian, that's all the time we've got for today. But before I let you go, do you have any final thoughts? Anything you'd like listeners to know? Anywhere you'd like them to go to learn more about the work that you guys are doing and the efforts to try to get a contract negotiation here that is fair and recognizing the work that ambulance paramedics do?
Yeah, I'll just leave you with the thoughts of, we are a very different union and a different profession. So we are motivated by helping others in our community and across the province. So, when we think about, historically how unions operate and that there's this contentious, relationship between the employer and the union and the employees, we've had a good relationship with the government for a long time. There's been significant improvements to the ambulance service, but we still feel that there's ways to go. We also are seeing a very different labor market here. And if we don't keep up to the changes of that, we are going to be in a staffing crisis in the next few years. We're keeping the tide back a little bit right now because people are stepping up, but overtime is completely necessary to keep the ambulance service going. We always joke that if tomorrow we decided, hey, Friday, nobody works overtime, the entire ambulance service would collapse by 9 a.m. There's no doubt in anybody's mind because there's so much overtime just to keep it going. But if you're looking for any information, we're on Instagram, Facebook, X or Twitter. We release everything on those platforms. If you need to know anything or if you want to follow us for more updates, those are the best places. Just look up APBC or Ambulance Paramedics of BC.
Perfect. And I'll make sure to put those links in the show notes as well. Ian Tate, Communications and Social Media Director for the Ambulance Paramedics of BC. Thank you so much for taking time out of what I know is a very busy start of the year. Good luck to you. And again, thanks for joining us today.
Thanks for having me.